Hello guys, my name is Jamal Sahradi and today I am going to present my assignment on analyzing strength and limitation of assertive communications. We're going to slide number 1, Introduction. Assertive communication is one of the most important communication skills in health and social care. It allows healthcare professionals to express the strength, their true concern and needs clearly while still respecting the rights and feeling of the other people. Unlike passive communications, assertive communications does not avoid important issues. At the same time, it is different from aggressive communications because it remains respectful and professional. In this presentation, I will explain the meaning of the assertive communications, discuss its strength and limitations, describe how it is used in the healthcare practice, explain how it can be adopted for different situations, and finally discuss ways to improve these skills. Slide number 2, definition and characteristics. Assertive communication means expressing your opinions, feelings, and responsibilities clearly, confidentially, and respectfully. An assertive person does not try to control or insult others. Instead, they communicate in a calm and professional way while also listening to the other people's opinions. Some important characteristics include speaking clearly, using a calm tone of voice, maintaining appropriate eye contact, and showing open and passive body language. In health and social care, assertive communication helps professionals maintaining professionals' boundaries, build trust, and encourage shared decision making with service users. To communicate assertively, healthcare workers also need self-confidence, emotional control, self-awareness, and respectful language. Let's go to slide number 3, strength. There are many strengths of assertive communications. First, it improves communications between healthcare professionals and service users by making information clearly to easy understand. Second, it helps staff ask for content, explain producers, and set professional boundaries respectfully. Another important advantage is that staff can raise concerns about patient safety without creating unnecessary conflict. Assertive communication is also useful during the patient handover, care planning, safeguarding situations, and difficult conversations. Finally, it support person-centered care because it encourages service users to express their professionals' choices and concerns while improving teamwork and reducing misunderstandings. Slide number 4, limitations. Although assertive communication has many benefits, it also some limitations. Sometimes people may misunderstand assertive communications and think it is a rude or too critical. This is especially true during emotional situations when people come from different cultural backgrounds. Less experienced healthcare workers may also find it difficult to stay calm when dealing with complaints conflict or safeguarding concerns. If professionals focus only delivering the message without showing empathy, they may appear cold or controlling. Cold or controlling, yes. For this reason, assertive communication should always be balanced with the active listening, compassion, cultural awareness, and emotional controls. Let's go to slide number 5. Slide number 5 is talk about applications in practice. Assertive communication is used every day in health and social care settings. For example, a care worker may explain that the correct equipment must be used before moving a patient safely. A nurse may inform another nurse that medication information is incomplete and needs to be checked before administrations. During family meetings, healthcare professionals can explain care plans, discuss safety issues, and answer questions respectfully. In different situations, assertive communications protects the safety, dignity, and lives of service users while avoiding aggressive or blaming language. Slide number 6. Assertive communications should always be adopted according to the person's needs and the situation. For example, for anxious patients, healthcare workers should speak calmly, use simple language, and passive reassurance. When caring for people with dementia or learning disabilities, professionals should use short sentences, repeat information when necessary, and support communications with body language or visual causes. When speaking with the upset family members, professionals should first acknowledge their emotions before setting clear and respectful boundaries. By adopting communications in this way, healthcare professionals can provide safe, respectful, and person-centered care. Let's go to slide number 7. Improvement strengthens. Assertive communications can be improved through regular practice and training. Healthcare workers should reflect on their own communications style and ask for feedback from their colleagues. It's also important to pay attention to tone of voice, body language, and word choice. Listening carefully before responding helps people feel respect and reduce conflict. Using I sentences instead of blaming language makes communications more respectful. And finally, supervision, role-playing, and reflective practice all help healthcare professionals become more confident and effective communications. Slide number 8. Reflection. In conclusion, I have learned the assertive communications in the essential skills in healthcare social care. Being assertive does not mean being aggressive. Instead, It means communications while confidence, respect, empathy, and professionalism. In my future career, I will assertive communications to raise concern, explain the care decision, maintaining professional boundaries, and support service in user making informed choices. Overall, effective assertive communications improve network, builds trust, increase the patient safety, and support person and centered care. Thank you for listening.